So, those of you that are sit for accountants will remember that old phrase, value for money, with 3 E's, remember that? Economy, effectiveness, efficiency. And largely it was about counting, wasn't it? And we probably didn't pay as much attention to effectiveness as we did to economy and efficiency. And actually, I think that the new concepts of value that people are talking about much more in this century are trying to unite those 3 things. When you look in a dictionary at the meaning of value, you get 2 different definitions. You get something around ethics and behaviours and kind of the inherent meaning of life. And then you also get something about usefulness or worth. I think probably in the context of what we're going to talk about today, it's the first, but I think the second value is also important. If I think about my own organisation, we have 5 governing objectives, which probably look a lot like yours. There's something in there about outcomes for patients, there's something in there about clinical effectiveness, and there's a whole objective in there about value for money for taxpayers. We also have separately a number of values that we recruit to, and they are all about how we expect our staff to behave with our patients, and we want to be welcoming, respectful, and open and reassuring. And they're different. They're different, but they're kind of linked somehow. So I think that's just an important thing to hold on to. And it plays back to what David was talking about in terms of why we're, what on earth are we doing in the care system? And I say the care system rather than the NHS because I think the integration piece is important for us. Some of you will have read Michael Porter. Hands up if you know who Michael Porter is. Brilliant, thank you, good. Okay, so I've got sort of a third of you are converted already. So Michael Porter, American academic, writes about value in healthcare systems. He is the man that talks about the outcome-cost ratio. So rather than just talking about cost, we need to look at outcomes. In America, his work is very much about quality outcomes, and they're largely around clinical outcomes. I think in the UK we have a slightly different debate because, of course, when we talk about outcome and quality, particularly in a post-Francis environment, we're also very interested in the patient's experience. And so actually we've got a slightly different take on Porter's work in the UK already. So I think we probably all agree that making decisions just on cost alone is not right, and making short-term decisions isn't right. So this work stream is very much, I think, about making better decisions, if you want to put it a different, rather than just talk about value and concepts, but how do we make really, really good decisions that are going to give us the best possible outcome. So I suppose the other thing to say about Porter's work, which is dead interesting, is that you need to measure more around the patient and around the patient's conditions. So rather than thinking in silos, we need to think about what's wrong with people. I mean, it's kind of obvious, isn't it? But let's have a look at measuring the whole the whole intervention for patients around chronic kidney disease or pregnancy or diabetes. But of course, those are cross-organisational. They break silos. They're different ways to thinking, than we've been used to in the past. So it's very much about outcomes, and it's very much about improving the quality of our decisions. The other thing, does anyone read? I wrote an article for the HSJ. I've never really done this before. I've written 2 recently. I bet no one in this room has read them, but it's kind of. I wrote about why accountants are going to be really good at measuring value, and it's actually because we can count, right? So there's something around the quality debate and lending the skills that we've learned as professional accountants to our colleagues outside our profession to help them measure quality. So how do we consistently measure the patient experience across the NHS? How do we consistently measure clinical outcomes? Any of you that work in hospitals might be aware of all the national audits that our clinical colleagues submit data to. The thing that I've learned recently, because my audit committee's got quite interested in this, is that data gets submitted largely by kind of individual clinicians who kind of have just got an interest in it. Doesn't really get kind of standardised, and it goes into national databases, and then people make quite big decisions about organisations' reputations, about how good an organisation is. So you'll have read about what happened with children's heart surgery up in Leeds. Well, again, that was poor data quality leading to some quite major decisions. So as an accountant, I look at that and think, aha, I think there might be something I can do about that. So my hypothesis is that we've got a lot to offer everybody out there, and it's all part of the value programme. So that's my kind of opening pitch. I've now got a question for you, which is here. So first question on your tables for 10 minutes, you can feedback after lunch, is what are the sort of decisions that you'd like this work stream to help you with. And you can go really, really big, or you can go really, really small. So it could be, actually, we find making, this is one of my own pet projects, I'm hoping somebody will talk about this, right? So we find making capital investment decisions really difficult. The Treasury guidance makes us make quite short-term decisions based on an organisation rather than a system, and we'd like some help with that. So if this goes really well, we're going to rip out the Treasury guidance and do something else. Is this going online? Right, brilliant. Okay, that went well. Limiting step number one. Or it could be, actually, I find it really difficult to measure service line performance in my organisation or in my hospital, my CCG, and I want some help measuring quality. It could be anything, and it could be between those. So go as large or small as you like, take the next 10 minutes, and then after lunch, we're going to come back with a couple more specific questions.